Okay, this video is going to be demonstrating the main approach for possible hip pain. So we're just going to assume that this is my dog with hip pain. It's bilateral, but we'll focus on the left side because that's the sight and view there. So we're going to start with CNS points, and the ones that I chose were bladder 23 and bladder 28. So bladder 23 is just lateral to the caudal aspect of the spinal processes of L2, so between L2 and L3. So first, kind of tracking from the last rib up to dorsal midline, that's gonna get me to the thoracolumbar junction there. So then I would palpate, so we have T13, L1, L1, L2, L2, L3. And then just at the caudal aspect of the spinous process is our bladder 23 point. The other CNS point I chose was bladder 28. So how we can find that is tracking kind of along the sacrum to the point that we dip in, which is usually our lumbosacral junction, or we can count backwards. This was L2, L3, L3, L4, 4, 5, 5, 6, 6, 7, 7, S1, so the lumbosacral junction. I'm actually going to put a point here as well because that's our Boway point, and that is one of the ANS, so autonomic nervous system points that I'm choosing directly on dorsal midline for that guy there. But going back to bladder 28, the other CNS point I chose, I can actually sort of from that lumbosacral junction palpate. We'd be looking for the first sacroforamina, which would be bladder 27, the second sacroforamina, and just going lateral to that point. Oops, that guy didn't stay in. We'll try that again. But just going lateral to the foramina is where the bladder 28 point is going to go there. I think I just needed a little bit more pressure inwards there. So we'll just carry on there and we'll cover the next peripheral point that I chose, which is spleen 9, because it's quite a powerful point to choose just with its various nerve innervations, distal to the joint, various muscle attachments there. So just to turn him here, and I'll just turn him to get a better view here. I would just be going distal to the medial tibial condyle there. So the flare at the medial aspect of the tibia, we're just gonna sink just distal to that point in a depression. And my tube's not working for this one, so I'll actually go for an untubed insertion of our spleen 9 here. Here we go. And I'll just turn to, I have the luxury of doing this in a stuffed animal. There's our spleen 9 there. So we've got CNS covered, we've got our two autonomic nervous points going. The next will be GB30 and spleen, spleen 9 was actually my second peripheral point. Stomach 36 is my other autonomic point. And then gallbladder 30 is my other peripheral point. So we can start with gallbladder 30. This is midway between the dorsal iliac spine, midway between the greater trochanter of the femur and the tuber ischiae. And so right about there is going to be GB30. Our final peripheral point. And then just going back to the autonomic points, so we had Boway, and the second point is going to be stomach 36. Again, because it's kind of in the pelvic limb region, it's in sort of the distal aspect of the muscle belly of the cranial tibialis. It has a lot of autonomic components to it. So that was our spleen 9 in there. And again, if I was palpating, stifle, and looking to go instead more on the lateral aspect, in the cranialis tibialis muscle. We have our stomach 36 there. Now for myofascial points, it would really depend on the palpation exam and whatnot. So some other areas where I might locate myofascial discomfort would be other areas in the hip flexor region. And so we had our gallbladder 30. The other 2 points that make up the hip triad would be a bladder 54 and a gallbladder 29. So for gallbladder 29, this would be a third of the way between the dorsal iliac crest and the greater trochanter, which I would palpate, and a third of the distance from the greater trochanter is our bladder 54 point. Oh, we lost that guy there. This is another one that's not wanting to go in well tubed. So just with a decisive untubed point, I'll put that guy in there. And then to finish off the hip triad, we can do our bladder 54, which is going to be just dorsal to the greater trochanter. And looking at this now, I think when I took out my gallbladder 29 point, I didn't put it in exactly where I wanted to. So because we're practicing, I can adjust. And gallbladder 30 or gallbladder 29 is likely to be more in that region there. Quadriceps are often also tight in hip pain situations, hip flexors, although I don't think I would necessarily want to go directly for sort of the iliopsoas, but we could add another quadriceps point with a spleen 10. So spleen 10 will be in the belly of the vastus medialis muscle. So we had our spleen 9, but opposite what would be stomach 34 is where the spleen 10 is gonna go. So we have a spleen 10 there just to kind of round it out. Now, I don't have an electroacupuncture device yet, but I do have a TENS, and so just kind of going through the practice process here, I think I would probably treat this patient, again, if we're thinking maybe we want to do some rehab afterwards, let's get some short-term pain relief going on and treat more at sort of the 80 to 100 hertz. And so the points that I'm choosing to hypothetically connect would be, I think my GB 30 and my spleen 9. So I would attach the clips to my gallbladder 30. I would attach the points to my spleen 9. And I'm choosing these 2 points because they span the joint. One is proximal, one is peripheral. Spleen 9 is quite a strong point. And so that is where I would connect. And once those probes were on properly, then I could adjust my settings and then turn up the intensity until I'm getting to the point that I want there. So that's my coverage of a possible treatment plan for hip pain in the dog.